Allergic reactions to insect bites or stings can be very serious. According to the New York Times, about 50 to 100 Americans die each year from the stings of venomous insects. That's why it's important to know how to treat somebody having an allergic reaction. To treat an insect sting, first remove the remaining stinger, being careful not to break it at the level of the skin since it contains some venom. Then disinfect the area and apply ice. Ibuprofen may be used to reduce swelling while relieving some pain. Antihistamines such as diphenhydramine, trade name Benadryl, may also be helpful. These are drugs that lessen the effects of histamine, a chemical the body produces in response to allergens.
9.2% of stings in untreated children lead to a systemic reaction called anaphylactic shock, where inflammation spreads throughout the body. Symptoms often develop within seconds. They include difficulty breathing, coughing, stomach cramps, anxiety, confusion, dizziness, fainting, hives, nausea, vomiting, and heart palpitations. In the worst cases, respiratory failure and cardiac arrest can occur. Call 911 immediately if you think someone is experiencing anaphylactic shock. In a recent case, the 18-year-old from Des Moines, Iowa, speaks about living with a venom allergy. She was stung for the first time when she was only 4, when a bee sting on her neck made it swell to the size of a balloon. She has been stung 4 times since and was immediately prescribed the auto-injector EpiPen to save her life. According to physician David Graft, about 3% of adults have had a history of one systemic reaction. On the other hand, almost none of them ever told their doctor about it. Of these 40 people a year, how many of them knew? The answer is 50%.
If you are allergic to insect stings and you are stung, you need to be prepared to give yourself emergency treatment with an epinephrine injection and then, if necessary, get to a hospital in the emergency room for further treatment and observation. EpiPens work by injecting epinephrine, a drug similar to adrenaline that narrows blood vessels and opens airways in the lungs. These effects can reverse severe blood pressure, wheezing, severe skin itching, hives, and other symptoms of an allergic reaction. Some examples of professions that are required to know how to treat allergic reactions to insect stings are entomologists, park rangers, and beekeepers. All of these people deal with nature and must know what to do in case someone gets stung.
Zach likes climbing trees, but little did he know there was a beehive in this one.
Oh shoot, jeez.
He tries running,
Ouch.
but eventually he gets stung. Luckily, Zach has gone through this before. He knew what to do and acted quickly. He took out his EpiPen, removed the blue cap, swiftly pushed the tip into his outer thigh at a 90-degree angle, and pressed the auto-inject button. This delivered the life-saving drug into his body. The EpiPen contains epinephrine that works to reduce coughing, wheezing, or other allergic reactions. The EpiPen is injected into the thigh because the thigh muscle is large, with lots of blood vessels allowing easy introduction of the drug directly into the bloodstream. If the allergic reaction does not stop, then the person should call 911, especially if the person does not know what stung him or if this is his first allergic reaction. Even if the EpiPen works, one should still visit the emergency room because the symptoms could rebound hours or even days after the first reaction. Therefore, it is recommended that even people who experience a single occurrence that resolves quickly should still be monitored in the emergency room. It is also advised that these patients be sent home with another dose of emergency epinephrine due to the possibility of reoccurrence later on.